By now, you've learned that aging leads to all kinds of conditions, from Alzheimer's to osteoporosis. These cause millions of people to suffer, cost billions of dollars for countries like the US alone, and have no cure. You've also learned that aging itself is kind of like a disease, characterized by all these different types of damage, from genomic instability to senescent cells. These types of damage are what lead to diseases like Alzheimer's and osteoporosis. And if we can find a way to reverse this damage, we could cure aging similar to the way we would with a disease. But we don't just need better cures and treatments. We need proper healthcare, proper systems and methods to get these treatments to people, whether it's for diseases caused by aging or in the future for aging itself. And spoiler alert, we're definitely not there yet. Right now, at least half of all hospital beds in America are occupied by people above the age of 65. And these numbers are similar for other developed countries with large aging populations. Because the elderly are spending so much time in hospitals and getting treatment, they encounter a bunch of issues. Because of these, the suffering from getting treatments can be almost as bad as having the disease in the first place. Adverse drug reactions are 4 times more likely to happen in seniors than in younger populations. These are basically drug side effects, but on steroids. Unintended consequences of taking a drug that can lead to major problems, like bleeding or an allergic reaction. Although your changing body chemistry as you age can affect drug responses, a major reason for ADRs is polypharmacy. Because seniors have so many conditions, they're given many drugs. For example, someone with stomach issues might take metoclopramide, a drug with a side effect of tremors. These tremors can be treated by a drug called L-DOPA, which is often used to treat tremors in Parkinson's disease, but has side effects of its own. This keeps creating a cycle, adding more drugs into the mix and more drug interactions. The thing is, the more drugs we throw into the mix and the more interactions we have, the less we know about the outcome. And that's why these ADRs happen. We keep giving seniors all these different drugs, but we don't currently have the capabilities to predict and therefore prevent negative interactions.
I had a hallucination that I was at the bottom of a stairwell, lying on the floor, and that there was the doctor in there, and he kept telling me that I was alone, that nobody was looking for me, and that, I might as well give up.
What happened to Aaliyah Davis is happening to thousands of elderly residents in nursing homes every day. They're being over-medicated with powerful antipsychotics, often to keep them docile.
Do you have any idea why they gave you so many antipsychotic drugs?
No,
Do you know if your behavior was strange or you were difficult or noisy?
I don't remember.
40% of all seniors are affected by polypharmacy, and the average senior is prescribed 7 different drug classes at a time. It's crazy how these treatments that are supposed to be helping can hurt. Another huge group of issues has to do with bed rest. Since the elderly spend more time in hospital beds than any other age group, they aren't getting the exercise that they need. And this can lead to a whole bunch of problems, like bone and muscle loss, muscle atrophy, and issues with circulation, like a higher risk of blood clots, and even a lower oxygen uptake. If you've ever broken a limb before, you've probably noticed that it looks really weak and kind of funky when it comes out of the cast. Now imagine that happening to your entire body. That's what happens to elderly people on bed rest, losing their muscle and bone mass and their muscle shape. This loss of bone and muscle mass and muscle atrophy, or the changing of shape, happens anyway due to aging itself. For example, your body isn't able to regenerate your bones and muscles as fast as it used to when you're younger. You lose motor neurons, which are key for sending brain signals to your limbs in order to trigger movement, and you lose muscle fibers. Plus, your body is creating fewer proteins, or the building blocks of your limbs, this is called anabolic resistance, and your hormones change. For example, in women, estrogen drops after menopause, which can lead to weaker bones, and in men, testosterone drops, which can lead to weaker muscles. But specifically while on bed rest, along with normal aging, vertebral bone loss can be 50 times faster in an older patient than in a younger patient. Muscle mass can be lost at a rate of 3% in just 1 week, and muscle strength can decrease by 50% in only 3 to 5 weeks of complete inactivity. This is because when you exercise, your body goes through really tiny amounts of damage. But don't worry, this is a good thing, because what doesn't kill you makes you stronger. This damage makes your body rebuild itself stronger through repair mechanisms. The damaged muscle cells signal for the immune system to come and damage control by undergoing inflammation. Think of this as creating a siren to catch the attention of the immune system by sending proteins called cytokines. Once the immune system kicks in, immune cells called macrophages come in and eat up the debris or damaged cells, and myosatellite cells or muscle stem cells come and fuse to the damaged muscle fiber. This rebuilds the muscle, but stronger than before. By the way, stem cells are cells that basically have no identity yet, a blank slate, but they can help the body regenerate by turning into more specific types of cells, whether it's a blood cell, a muscle cell, or a neuron. Myosatellite stem cells are a specific type of stem cell that can only turn into muscle varieties. I find this space really interesting because stem cells have a lot of different applications in the area of treating age-related diseases. So if you're interested in learning more, you can check out the TKS Explore module that I built on the topic. Anywho, when you're on bed rest, your body isn't getting that wear and tear from exercise. So instead of growing and rebuilding, your muscles will shrink and change shape. Same goes for bones. Exercise causes your bones to remodel and become denser and stronger. This remodeling happens when osteoclasts clear away the old bone cells, and osteoblasts, which also come from stem cells, create the foundations for new bone. Think of this like a construction site, and less exercise equals a less efficient and effective construction team. As if bone and muscle issues weren't enough, elderly people are also 30% more likely to develop blood clots in the legs while on bed rest. Your body creates blood clots anyway, from cells in your bloodstream called platelets and proteins in your blood plasma, to create a plug and stop too much blood from leaving your system if you get an injury. But while you're on bed rest, the blood flow to your limbs is lesser, disrupting your normal circulation and allowing blood clots to form more easily. These clots can cause real danger if they travel to other parts of your body. For example, if they travel to your lungs, that's called a pulmonary embolism. And the death rate for those can be higher than that of a heart attack by almost double. Speaking of circulation, your blood is vital for delivering oxygen to different parts of your body. So remove that proper circulation during bed rest, and your oxygen uptake is lower because it's harder for oxygen to reach your muscles from your lungs. You don't have to have a PhD to know that oxygen is essential for life. So if you have a lower oxygen uptake, you could have a higher risk of conditions and diseases that could lead to death. Again, just like with polypharmacy, you can see that even when seniors are getting treatment for the conditions they have, they encounter so many other issues, from being on bed rest or hooked up to machines for a long amount of time without being able to move. We need to find ways to prevent this without sacrificing the care that they get at hospitals. Finally, elderly people in hospitals have to experience an issue that's awkward at best, but at worst can lead to awful rashes or infections from bacteria or yeast. And that's incontinence. Over 40% of hospital patients above the age of 65 have to deal with not having control over when they can use the bathroom. At hospitals, seniors are in unfamiliar environments. Pair that with lower mobility and weaker limbs, and it can be hard to get to a bathroom in time. Or at all, thanks to equipment like IV tubes, nasal tubes, or cardiac monitors. As they age, the elderly also have weaker bladder and pelvic muscles, and in patients of movement disorders like ALS and Parkinson's, damage to the nerves that control the bladder, which decreases their ability to use the bathroom even more. So they have to rely on bedpans, which are quite uncomfortable, or diapers. But patients who have lost their ability to remember, either through diseases like Alzheimer's, cognitive impairment, or side effects of certain drugs, might not notify their caregivers in time to change the diaper. So they wear it for a really long amount of time, which can lead to infections and rashes. There's all these technical and medical issues that come with incontinence, but it also just takes a huge toll on an elderly person's dignity. I know people our age don't often have to deal with this problem, but if I was in this position, I would be pretty embarrassed about having to have caregivers change my diaper all the time or something. These are all just some of the issues with how we deliver hospital care to the elderly. But there are so many more where that came from. I could be here all day talking about the issues with the healthcare system. But the point is, it's not just about curing disease or even curing age-related damage or aging itself. It's about delivering those treatments and cures properly. We need to think about the care experience that we're giving elderly people, what the side effects of those systems are, and how we can fix them.